Most people who receive a late-stage cancer diagnosis didn't ignore their bodies completely. They noticed something, a symptom, a change. They just convinced themselves it was nothing. And that gap between noticing and acting is where outcomes are decided. This video exists to close that gap. Here's the uncomfortable truth about cancer. It rarely announces itself dramatically. There's no sudden alarm, no unmistakable signal that forces you to pay attention. Most of the time, the early warning signs are subtle. Easy to explain away, easy to put off, easy to forget about until weeks or months have passed. And by the time symptoms become impossible to ignore, the disease has often had a long head start. But here's what's also true. Early detection changes everything. For most cancers, the difference in survival between catching it early versus late isn't marginal. It's enormous. We're talking about outcomes that are decades apart. So in this video, we're going through the key cancer warning signs, organized by cancer type, that medical guidelines specifically flag as urgent, not to frighten you, but because knowing these could genuinely save your life or the life of someone you care about. Let's go through them one by one. Bowel cancer, the one people are most likely to dismiss. Bowel cancer is one of the most common cancers around, and one of the most survivable when it's caught early. The problem? Its early symptoms are exactly the kind people talk themselves out of acting on. Here's what to pay attention to. If you're over 50 and you notice blood when you go to the toilet, blood in your stool or on the tissue, and no doctor has told you it's from hemorrhoids or another known cause, that needs urgent investigation, not eventually, now. If you're over 60 and you've developed new iron deficiency anemia, or you've noticed a persistent change in your bowel habits, going more or less frequently, or a different consistency that's been there for weeks, that also needs to be checked urgently. For anyone under 50, rectal bleeding combined with any of the following, unexplained weight loss, abdominal pain, or a change in bowel habits, still needs to be taken seriously and investigated. The word that ties all of this together is unexplained. If a doctor has already identified a cause and you're being treated, that's different. But new, persistent, unexplained symptoms? Don't wait. Lung cancer. It's not just a smoker's disease. Lung cancer is the leading cause of cancer death. And one of the main reasons is that it often produces no symptoms at all in its earliest stages. By the time most people notice something, it's already progressed. A new cough that persists for more than 3 to 6 weeks, not from a cold, not a tickly throat, but a cough that simply won't go away, needs a chest X-ray. Coughing up blood is always urgent, even small streaks of blood in your mucus when coughing. No amount is too small to take seriously. Unexplained breathlessness, persistent chest discomfort, or significant fatigue and weight loss with no clear cause, these are all flags that warrant prompt investigation. And before you think this doesn't apply to you because you don't smoke, lung cancer does occur in non-smokers. The symptoms are identical. If they're there, they matter regardless of your smoking history. Breast cancer. Check and know what you're checking for. Breast cancer is the most common cancer overall, and when it's caught early, outcomes are generally very good. The most important thing you can do is know your own body, because changes only become obvious when you know what's normal for you. The primary warning sign is a new lump or mass in the breast that persists, something that wasn't there before, that you can't explain, and that doesn't go away after your next menstrual cycle. But lumps aren't the only sign. Skin changes, dimpling, puckering, or a texture that resembles orange peel matter. Nipple changes, particularly a nipple that starts turning inward when it never used to, or unexplained discharge, matter. Unexplained swelling in the armpit matters, because that's where the lymph nodes that drain the breast are located. Importantly, this applies to men too. Breast cancer in men is diagnosed later on average, largely because the possibility isn't considered. If a man finds a lump in the chest area, it deserves the same attention. Any new persistent change that you can't explain, see your doctor. Ovarian cancer, the one that gets misdiagnosed the most. This one needs its own moment of attention because it has earned a difficult reputation. Ovarian cancer is frequently called a silent killer, not because it produces no symptoms, but because its symptoms are so easy to attribute to something else. Many women spend months being told it's IBS, stress, or a digestive issue before someone eventually looks further. The 4 symptoms to know are persistent bloating, not the kind that comes and goes after meals, but a consistent, ongoing bloating that doesn't resolve. Feeling full very quickly when eating, or a loss of appetite that's new and unexplained. Pelvic or lower abdominal pain that keeps coming back. Urinary urgency, needing to go more often or more suddenly than usual. Individually, each of these has plenty of innocent explanations. But when they're persistent, when they're happening regularly, and when they're new, That combination warrants a specific blood test and an ultrasound. Don't let anyone, including yourself, brush these off as hormonal or digestive without getting them properly checked. Blood in your urine. One rule, no exceptions. This one is simple, and it needs to stay simple so it sticks. If you see blood in your urine, pink, red, or dark brown, and there is no already explained reason for it, you need to see a doctor urgently. It might not be cancer. There are other causes, infections, kidney stones, and others. But visible blood in the urine is always a red flag and always needs investigation. At any age, no exceptions. Urinary symptoms that are new and persistent, changes in flow, frequency, or urgency, particularly in older adults or people who smoke, also deserve prompt attention. Blood in the urine. See a doctor. No delay. Skin. The cancer you can actually see coming. Melanoma, the most serious form of skin cancer, is one of the few cancers you can potentially catch yourself before it ever needs a scan or a blood test. The ABCDE rule is what to look for when examining moles or skin changes. A. Asymmetry. One half doesn't match the other. B. Border. The edges are ragged, uneven, or blurred rather than smooth. C. Color. Multiple shades within the same spot, different browns, black, or even areas of red or white. D. Diameter, growing larger over time. E. Evolution, any change at all, in size, shape, color, or new symptoms like bleeding or itching. Beyond moles, a sore or ulcer on the skin that simply isn't healing after several weeks, especially on areas regularly exposed to the sun, also needs to be checked. Check your skin regularly. Know what your moles look like. Evolution is the key word. Change is the signal. Blood cancers. When your body stops fighting properly. Leukemia, lymphoma, and related blood cancers don't show up as a lump you can feel or a visible change on the skin. Their symptoms tend to be systemic, affecting how your whole body feels and functions. Extreme, persistent fatigue, the kind where you're sleeping enough but still feel completely depleted, is one signal. Unexplained paleness, looking significantly paler than normal. Night sweats, waking up drenched without explanation. Recurrent infections, or infections that seem unusually severe or slow to clear, which can suggest the immune system isn't functioning as it should. Unexplained bruising, appearing without any injury, or bleeding that takes longer to stop than it should. And swollen lymph nodes, lumps in the neck, armpits, or groin that are persistent and, importantly, painless. Painless, swollen lymph nodes that don't go away are always worth investigating. Any of these symptoms in combination, especially if they've been present for weeks, warrants blood tests. Brain. When symptoms keep getting worse. Brain tumors are relatively rare, but the key warning here is progression. Most headaches are harmless, but a headache that is genuinely new, getting progressively worse over time, and not explained by anything else, especially one that's worst in the morning or that wakes you from sleep, deserves attention. The broader red flag category is any neurological symptom that is worsening rather than improving. Weakness on one side of the body, coordination problems, new visual disturbances, speech difficulties, or personality and memory changes that are gradual and unexplained. These symptoms, particularly in combination or when they're progressing, need a brain scan, not after a few more weeks of watching and waiting. Promptly. Unexplained lumps and weight loss, the two universal flags. Before we wrap up, two symptoms that apply regardless of cancer type. Any lump anywhere on the body that is growing, especially if it sits deep below the skin surface rather than in the skin itself, if it's larger than roughly 5 centimeters, and if it's firm, needs to be assessed with an ultrasound. Don't assume a painless lump is harmless. Many serious lumps cause no pain at all in their early stages. And unexplained weight loss, losing a significant amount of weight without changes to your diet or activity, without another explanation, is one of the most universal early cancer signals there is. Multiple cancers can cause it before any other symptom appears. It always warrants investigation. The one word to remember. If there is one word that connects every single warning sign in this video, it's this: unexplained, new, persistent, no obvious reason, not getting better on its own. That's the pattern. That's when you act. Not panic, not emergency rooms for every minor concern, but prompt, persistent action. Booking a GP appointment, describing the symptoms clearly, and asking for investigation. Catching cancer early isn't luck. It's often the direct result of someone paying attention to their body, recognizing that something had changed, and deciding not to wait. The gap between noticing and acting is where outcomes are decided. You now know what to look for. Don't wait. Thanks for watching, and I'll see you in the next video.